Well, it's very interesting to find that the Ministry of Health hasn't been left behind in this year's agriculture and commercial show to do with the theme business in a changing environment. Let's just find out on how they associate themselves with the theme. Dr. KAMOTO MBEWE, welcome to the interview.
Thank you so much, and welcome to our Minister of Health stand.
Yeah, how's your participation here? How are you associating yourselves with this year's theme?
Well, we find ourselves to have a role with the changing environment. We are looking at how we can provide better care in a clean environment by competent people and in a caring manner. And to do that, we have several institutions under the Ministry of Health, but we have selected a few that will tell you and tell the public through you how we are responding to the changing environment in terms of provision of care.
Before we come to that, how are you interacting with the general public? I'm sure your main purpose of exhibiting here is to interact with the general public.
Yes, we're interacting very well. We have had a very good turnout. People are very interested in finding out what we are doing to provide services for them. So we have had very good turnout indeed.
What sort of inquiries are they bringing forth?
Well, like for example, cancer, they want to know what are the new methods of treating cancer. Food and drug there, they want to know what is being done to test the food that we eat. So, and there are several others. For example, people want to find out more about the vaccines, the new vaccines that have been introduced to protect the public. The HPV vaccine, the vaccine to prevent pneumococcal infection, the vaccine to prevent diarrhea diseases in children. So they are having these areas of interest.
China Hills College Hospital, how are you relating yourselves to business in a changing environment?
Yeah, all in all, you cannot have good business if your mind is not state, if your mind state is not stable. So we are saying that it's only when we develop our mindset that's when business in the changing environment can happen. Now, in Chainama Hospital, we have a diverse of activities that take place. The services that we offer range from medical to social services. In the medical model, we have, as you can see, there are drugs here that we use in the treatment of mental health cases. And also, we have ARVs. Of late, we have a trend of HIV and AIDS, which is bringing a lot of mental health issues. So we have incorporated antiretroviral drugs in accompanying and mental health treatment. Then we have in the social model, we have got psychologists, we have got social workers, we have got occupational services. As you can see around, there are a lot of items that our patients are making so that we make them be self-reliant in the changing environment. Because if we have so many people who have a lot of problems, the development of the nation cannot take place in the changing environment. So we are hereby bringing in social services so that all our clients throughout the nation can be able to be rehabilitated, they can be helped in order to suit in the changing environment.
Dr. Banda, the cancer hospital, I'm sure it's doing very fine. It's got a mammoth task to make people aware on how cancer is being managed here in the country. What's your participation like here?
Okay. As Cancer Disease Hospital, we are a tertiary hospital who look after cancer diseases in this country. And as such, we have come up with ways in which we look after cancer patients. We have departments. We have Department of Oncology, Clinical Oncology, and that's where you find the people who actually are in contact with the patients. And we have the other support departments as well. We have pharmacy, we have the lab, we have the diagnostic side of it. and we have also the palliative care, and then we have the nursing and the other support groups as well.
Okay. What's your business here at the showgrounds?
Here we are trying to showcase what we do at Cancer Disease Hospital, telling the people on the new things, the new development that we have. As Cancer Disease Hospital, we are responding to the changes that are going on in this country by way of investing in the new building, maybe which you have seen at our center. We are coming up with inpatient care, where our patients will be admitted. As of now, our patients end up in UTH, and some patients are pushed out and they don't have anywhere to live during the time of treatment. But now we'll have them within our hospital as well. And then we are investing in new equipment as well. We are currently waiting for another cobalt machine because there are more patients who are coming to cancer hospital, so we need to cater for every patient so that they don't wait. There is also a new equipment that we installed, the high dose rate machine.
Mr. Cheruizo MUSONDA, I'm a King Officer Anesthetist. Welcome to the Operating Theatre Department under Ministry of Health. This year's theme says business in a changing environment. As you know that in this changing environment, there are many people who've got cardiac conditions. So in anesthesia, we've got challenges, but still those challenges have been embraced with technology, with this modern equipment. We are able to monitor the patient's status, the physiological status once they're on the table. We monitor the electrophysiology of the heart because the heart is the only organ which has got electrical impulses in the body. So it has to display a normal rhythm. Whenever there is an abnormal rhythm, that's when now we have to shock the patient using a defibrillator in this manner. So in such ways that when we are using a patient vitals monitor, it is incorporated with the mechanism of monitoring the patient's blood pressure, also the saturation of oxygen in the body. So when there isn't any flow of oxygen to the patient, you find that we are able to intervene or assess where the problem is. So we are able to provide safe anesthesia, safe delivery in most of the theaters because we are equipped with modern equipment, monitors. We have also drugs which we can give to a variety of patients with this changing environment. If a patient is diabetic, a patient is hypertensive, there are drugs which we can give so that we can reduce the blood pressure. We have also other drugs which also help us to supplement anesthesia. So in terms of safe delivery with this changing environment, you'd find that things have changed now. We are highly equipped. We have infant resuscitators where we resuscitate the newborn whenever they are born. Thereby also we are being involved in mitigating mitigation in terms of achieving the MDG 4 and 5. Because the neonatal mortality rate are reduced usually in theaters because we also intervene in terms of resuscitating, thereby avoiding birth asphyxia, which usually complicates to cerebral palsy. Learning disabilities also, you find that a child may develop growth retardation.
We've been at the Ministry of Health. We've learned on how the ministry is participating in this year's Agriculture and Commercial Show and how it is associating itself to this year's theme, business in a changing environment.